Hepatitis is an inflammatory condition of the liver and it's commonly caused by a viral infection, but there are other causes as well. The liver is in the right hypochondriac and epigastric area and performs many critical functions affecting metabolism like bile production, filtering toxins, excretion of bilirubin, breakdown of carbs, fats and proteins, activation of enzymes, storage of glycogen, synthesis of blood proteins, and synthesis of clotting factors. Viral infections of the liver that are classified as hepatitis include hepatitis A, B, C, D, and E. A different virus is responsible for each type of virally transmitted hepatitis. Hepatitis A is always an acute, short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. For all forms of acute hepatitis, histology is characterized by lobular disarray, which includes ballooning degeneration, spotty necrosis, predominantly sinusoidal and lobular mononuclear cell infiltrate with occasional neutrophils and eosinophils, and Kupffer cell hyperplasia. Hepatitis A is caused by an infection with hepatitis A virus. This type of hepatitis is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. The HIV-IgM antibody test detects the first antibody produced by the body when it is exposed to hepatitis A. This test is used to detect early or recent infections and to diagnose the disease in people with symptoms of acute hepatitis. Hepatitis A usually doesn't require treatment because it's a short-term illness. However, bed rest may be recommended. The hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages 12 and 18 months. It's a series of 2 vaccines. Vaccination for hepatitis A is also available for adults and can be combined with the hepatitis B vaccine. Hepatitis B is transmitted through contact with infectious body fluids such as blood, vaginal secretions, or semen containing the HBV. Injection drugs use, having sex with an infected partner, or sharing razors with an infected person increase the risk. For hepatitis B surface antibody, anti-HBs, a level less than 5 MIU is considered negative, while a level more than 12 MIU is considered protective. Any value between 5 and 12 MIU is indeterminate and should be repeated. Acute hepatitis B doesn't require specific treatment. Chronic hepatitis B is treated with antivirals and must be continued for several months or years. Hepatitis B can be prevented with vaccination. The series of 3 vaccines is typically completed over the first 6 months of childhood. Hepatitis C virus is transmitted through direct contact with infected body fluids, typically through injection drug use and sexual contact. HCV antibody test detects antibodies in blood produced in response to HCV infection. HCV RNA test detects and measures HCV RNA in the blood. HCV genotype test determines the specific subtype of the virus. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. However, no vaccination has been prepared. Hepatitis D is also called the delta hepatitis and is contracted through direct contact with infected blood. It occurs in conjunction with hepatitis B infection. HDV infection is diagnosed by high levels of immunoglobulin G and immunoglobulin M anti-HDV and is confirmed by detection of HDV RNA in serum. No antiviral medication exists for the treatment of hepatitis D. A drug called alpha interferon can, however, be used to treat hepatitis D. It can be prevented by getting the vaccination for hepatitis B. Hepatitis E is a waterborne disease caused by the hepatitis E virus. It is mainly found in areas with poor sanitation and typically results from ingesting fecal matter that contaminates the water supply. Anti-HIV-IgM is the serologic marker of choice for diagnosis of acute HIV infection. Currently, no specific medical therapies are available. Because the infection is often acute, it typically resolves on its own. However, pregnant women require close monitoring and care. Signs and symptoms may not occur until the damage affects liver function, include fatigue, flu-like symptoms, dark urine and pale stools, abdominal pain, loss of appetite and unexplained weight loss, yellowing of skin and eyes indicative of jaundice. People with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, liver cancer. Complications of liver failure include bleeding disorders, ascites, hypertension, CKD, and hepatic encephalopathy, and also lead to death. World Hepatitis Day is commemorated each year on 28 July to enhance awareness of viral hepatitis. The date of 28 July was chosen because it's the birthday of Nobel Prize winning scientist Dr. Barack Bloomberg, who discovered hepatitis B virus and developed a diagnostic test and vaccine for the virus. Hepatitis awareness can be raised by identifying at risk patients, encouraging vaccinations, providing educational resources,